Yo, what's up? Dr. Victor here. You know, I'm a diabetes doctor and patients keep asking me, Doc, what should I eat to best control my diabetes? What meals should I eat? So I thought, what a good subject for today. Let's talk about good meals that are gonna help with your diabetes. Now, these meals will be specifically for type 2 diabetes, because if you're type 1, then you can in theory eat whatever you want, but just keep track of your carbohydrates and the insulin amount for each meal. But either way, these are gonna be healthy meals overall. Now, the first thing to know, and I bet you know this, is the foods that can raise your blood glucose, so you have to be careful about. And these are basically foods that contain carbohydrates. The higher a food is in carbohydrates and the more processed it is, the more and faster it's gonna raise your blood glucose. And your overall goal if you have diabetes is to have your blood glucose as normal as possible. So let's start with the first meal of the day, breakfast. But before we go into specific examples, it's important for diabetes control to have regular meals throughout the day. First of all, for satiety, and this can improve long-term the weight loss that you can achieve. And also, if especially you're on blood glucose lowering medication that has a risk of hypoglycemia, it's good to have regular meals because this can also reduce the risk of hypoglycemia, like sulfonylureas, thiazolidinediones, and insulin. So first meal could be something like oatmeal with fruits. I'm gonna also hit up the macros on screen for this meal. 50 grams of oats, which you can cook them, or you can combine them with a yogurt and some fruit. This meal is gonna fill you up. It's low in calories, it's high in fiber, it's really tasty, easy to make, so what's not to love? The easier the meal is to prepare, the better the chance of you actually going and doing it and eating it throughout your week. Another good variant is to do something like an omelette from 2 eggs with some vegetables and a slice of bread. This is going to have close to 30 grams of carbs per meal, and again, this is a meal high in protein, which will help with satiety throughout the day and also to reduce the chance of you binging or having something to crave like sweets throughout the day. And also, protein helps with stabilizing blood glucose. And if you're on a statin, so a lipid lowering therapy, or if you have a disease that causes high cholesterol, then you can just reduce the egg yolks and go with egg whites, because the cholesterol is in egg yolks. And as a general rule, this is what all of your meals should look like throughout the week. High in fiber from vegetables and cereals, grains that are gonna increase your satiety levels and also are gonna stabilize the blood glucose. And high in protein also, because this again will increase your satiety, also will maintain your muscle mass and will help reducing blood glucose variations throughout the day. Another easy and quick option is to go with a wrap. I choose a whole wheat wrap because it's high in fiber and it kind of has the same taste, with some protein like chicken breast or some ham that you throw in there. Really tasty with some mustard, ketchup, and a whole lot of vegetables. Spinach, lettuce, whatever you wish, tomatoes, cucumbers. You can go all in, like be like a Picasso with this wrap, you know? Be creative, try every day something new, something different, but it's gonna work nonetheless because it's easy, high in protein, satiety, high in fiber, amazing for your blood glucose and also for your weight. If you do have diabetes, and especially if you're overweight, because most people with diabetes are overweight, type 2 diabetes, I strongly recommend you go with a food journal, so you keep track of everything you eat at least for a week, because in this way you're gonna slowly realize what you actually eat throughout the day and what you can improve. I see with my patients. If you keep a food journal, this is gonna help you a whole lot, because only then you're gonna be conscious about how much, what you eat, your meal times, and what you can improve, what you desperately crave. You can notice some patterns. Oh, look, when I get home and I'm really tired at night, I just destroy the fridge and I get a lot of sweets. And guess what? If you're gonna do this food journal, at least for 1 week, you're gonna be surprised if you weigh yourself at the start of this journal, and then in a week, you are gonna lose weight most likely, because unconsciously you're gonna improve the way you eat and you're gonna eat more healthy. So please write in a comment the weight that you're starting with before going with the food journal, and then write a comment again in a week, first thing in the morning, if you weigh yourself, and you're gonna be surprised. But keep the journal 100% correctly. So if you're eating like a sweet, like a piece of chocolate, write everything down there. Now, how about some snacks, some healthy snacks? The best you can choose, especially if you have a sweet tooth, is to go with fruits, and also learn the amount of carbohydrates in fruits. There are certain fruits that are better for diabetes, certain fruits that are much higher in carbs and increase your blood glucose, especially dried fruit, of course, because it's more concentrated in glucose, in carbs. But for example, watermelon is an amazing fruit because it has like a whole slice, 100 calories and 20 grams of carbs, not even that, so it's perfect for diabetes control, especially if you're craving something sweet. Another amazing snack is yogurt because it's high in protein, or other dairy products like milk. Kefir, high in protein, increases satiety, doesn't really contain that much carbs, so it doesn't affect your blood glucose. But choose plain yogurt, none of that horrible stuff with 20 grams of sugars and fruits, and just look at the label to be sure. Another healthy choice is a handful of nuts, but something like 20 grams of nuts, because you can easily go overboard with calories related to nuts. Like 100 grams of nuts, which is like a big handful, are like 600 calories at least, depends on the nuts. So careful with them nuts. An important thing to keep in mind if you have type 2 diabetes is that you can drastically improve your diabetes, and you can even have a chance of treating completely your diabetes, so going into remission. That means you have no need for drugs to control your blood glucose. If you lose weight, it's considered 5 to 10% of your body weight. You can also have this in mind, try to see the amount, the weight that you have each week, and try gradually to lose weight, improve the way that you eat, because these meals are also going to help with satiety. By the way, if you want me to talk about this subject, diabetes remission, in another video, please leave it in the comments, because there are ways like diet, weight loss, and also bariatric surgery to go into diabetes remission. How about lunch? Something easy to make, like some chicken breast or some chicken drums, oven baked or grilled, with a big side of veggies, whatever you wish, a big salad, some broccoli down there, also with some baked potato or some boiled potato. An amazing meal, healthy carbs, unprocessed foods, high in protein. What more do you want? Make it for like 2-3 days to have more meals in bulk. Again, in the same direction, you can go with some chicken breast or some lean beef and some rice, some veggies, some whatever you like combined with the rice. Some healthy salsa right there. An amazing meal, high in fiber, high in protein. And again, the most important thing for you to do to control your diabetes is to actually learn and find out the amount of carbohydrates in foods, because if you don't know what foods have carbohydrates and raise your blood glucose, you're not gonna have any idea why your blood glucose is high or low at a certain point. And a good thing related to meal times would be right now to actually make a plan and set certain times for your meals throughout the day. It only takes like 1 minute. How about some dinner time action? Now, if you have type 1 diabetes or type 2 and you have insulin, then it's important to eat a certain number of carbs throughout the day and at each meal, this meal being the same. But if you're not on insulin or drugs that increase the chance of hypoglycemia, I recommend something more light, lowering carbs at this meal that is gonna fill you up and increase the chances of you losing weight. Something high in protein and high in fiber. For example, a big portion of salad with some low-fat cheese, maybe some ham, some protein right there, some olives, a beautiful salad that you can make pretty easily. How about some tuna salad with an egg, a lot of veggies, tomatoes, beautifully seasoned, whatever spices you like. Or maybe if you like fish, you can go with some grilled or oven-baked salmon with some veggies, like a side salad, some broccoli, some beautifully sauteed vegetables like mushrooms, peppers, with some asparagus, which is under 20 calories per 100 grams, so an amazing vegetable. So as you can see, it's not that complicated. Pretty much you're gonna be focusing on fiber and protein, and this is gonna help with blood glucose control throughout the day, with your appetite, satiety. Also try and experiment with the foods and the meals to actually eat something that you enjoy. No point in eating something that you're gonna hate for a week and after you're gonna go back to your previous diet after a week. There's no point in that. Try and actually eat things that you enjoy and are also healthy. And again, remember, if you're on an insulin regimen, talk with your diabetes doctor about a certain amount of carbs that you need to eat at certain meals, because it's important to have this in mind to reduce the risk of hypoglycemia. And actually, a low-carb diet has been shown to improve the outcomes and the evolution of diabetes. So if you wish, you can even go low-carb, keto, you can even go intermittent fasting, but I find it's difficult for people that have problems with satiety and appetite and binges and cravings and sweets to go all out a lot of hours without eating anything, especially if you have a hectic schedule, so be careful about that. But it could work for some, but still choose healthy meals. It's not a pass to eat horrible or processed food because you're fasting, okay? And again, please leave in the comments if you're going with that food journal challenge, and write it in the comments the weight you're starting weight, and again in a week. But remember to always weigh yourself first thing in the morning, before eating, after you went to the toilet, and in the same outfit. If you did enjoy the video, please leave a like, share, subscribe, because it helps growing the channel, and we'll see each other next time. Thanks for watching. Salut!